Hi, good afternoon, or is it still good morning? I'm Josette Saxton with Texans Care for Children. I cover mental health policy, but I'm here today to speak to the DFPS staff report, largely around issue 6, or I should say solely on issue 6, which addresses prevention and early intervention. Mental health stakeholders were looking to the DISH's staff report to look for, well, what's going on about mental health prevention, and there's nothing there. The one place that we do see prevention being addressed within the HHS staff reports were in DFPS, really looking at it through the child welfare, child abuse and neglect lens. I will have to say I'm very thankful for that, and I support the recommendation that the state needs to elevate prevention and early intervention, and it needs to do a better job of tracking outcomes and telling the story of the impact that these programs have. What I do say is, what I do not agree with is that the legislature has endorsed Department of Family and Protective Services as being the primary prevention agency. I think that is a de facto response based on a lack of really thoughtful or strategic planning on how we as a state address prevention and early intervention across systems. Because if you look at it, we have mental health, the various prevention that is being funded across agencies. We have mental health prevention, substance abuse prevention, delinquency, dropout prevention. All of these are siloed in different agencies, but yet they're all largely addressing common root problems. A lot of the interventions that are effective at addressing these issues target common protective factors and common risk factors. But yes, when we're looking at them, we're just looking at them in discrete silos. These problems don't happen in discrete silos. Often they are co-occurring, and I think the state can do a better job of effectively and efficiently promoting healthy child and youth development and successful kids if we take the opportunity to do a strategic, thoughtful look at how we address prevention in the state. I should probably just say what Dr. Catherine Bareilles with One Voice said, ditto that. In terms of her recommendation about using this process, the sunset process, to take a broader look at how we as a state address prevention and early intervention. Specific recommendations. One, I would say home visiting, I mentioned, is a perfect example of an intervention that addresses a broad range of outcomes. It's just not about child abuse and neglect. It also produces outcomes related to school readiness, child development, child safety, even delinquency issues. So again, don't just put it within a child abuse and neglect agency. Prevention and early intervention should be elevated across all agencies, again, not just DFPS. Strategic planning relating to prevention and early intervention needs to occur across all agencies, and better measuring of outcomes so that we could best understand the impact that we are getting. Right now, if we are using these interventions and we're just measuring, well, what are the abuse and neglect rates, but we're not capturing how is that programming helping kids stay in school, helping kids not get involved in substance use or in delinquent behaviors, we're missing the true impact of the dollars that we're spending. Thank you.
Thank you, Ms. Saxton. Appreciate your testimony.